Hello, I'm Dr. Greg Doka from Clearwater Spinal Rehabilitation. Thanks for taking a moment to watch this video and learn about our practice and what regenerative medicine is. I've been serving this community for over 20 years and get a real kick out of watching people get better. It's really the biggest joy in my life. Regenerative medicine is very simple to explain. It's basically, we are always healing our own body. So if you cut yourself and then the body heals up that wound and you have new skin, that's regeneration. Regenerative medicine is the employment of cells that are either donated or from your own body to help speed that healing process along. So you can get regenerative cells from bone marrow, from your own body, from fat cells, or they can be donated. We get the cells that are donated because they tend to be a lot more powerful, and I'll explain why. So a lot of people ask me, well, where are these cells coming from? We only get cells that are donated from a live birth. Basically, a woman who gives birth to a baby, she will donate that umbilical cord, and those cells are then used for regenerative medicine. And those are the ones that we use in our office. We opt to use those cells because the trophic factors, trophic means growth, are so powerful. So think about the cells in your body as workers, all right? So you've got these workers that are assigned to do one thing, repair tissue. Now, as you're aging, those cells are also aging. So they're not nearly as effective and they're not nearly as productive because they're a little older. That's why we don't bounce back when we're older like we did when we were younger. The cells that are coming from this umbilical cord are as trophic as they can be. Growth factor, that's that word again, trophic. And that's a key to healing up tissues like this knee that I have on display, and I'll talk about that in just a second. Why are trophic factors so important? Well, again, we don't bounce back like we used to because these cells in our body just aren't as efficient. They're not as aggressive as they once were. So when we take these cells from the umbilical cord and introduce them into, say, a knee joint, right, it goes straight into these damaged tissues and begins to grow new tissue to heal that knee, to get it back to normal. We have seen astounding results. People that basically have tried everything else. They've been to physical therapy. They've had cortisone injections. They've had the Visio injection that's to lubricate the joint. Some of those things can work, but when it's bad enough and you've tried it all and you're thinking, hey, I need a knee replacement, please come talk to us first. We may be able to keep that from happening. We have had some incredibly good results with this therapy, and I would love to talk to you about this. So if you have questions about us, about this process and about us, schedule a consultation and come talk to us. We'd love to show you what we do and why it's so effective. And maybe it'll be a fit for you, maybe it won't, but come on in and talk to us and then we'll find out. Hope to see you soon. Thanks so much.